We're not letting American Heart Month end without a powerful reminder of a genetic heart condition that affects our youth. It's called Sudden Arrhythmia Death Syndrome, or SADS. Joining us live this morning, Dr. James Perry with Rady Children's Hospital, along with Rachel and Bella Flores, here to share their story. Thanks so much for being here, everyone.
Thanks,
Dr. Perry, let's start with you. What is SADS? How does it impact our children as well as adults?
Yeah, there are a number of heart rhythm problems that can present in the young. The estimate is about 1 in 1,000 or so, just to give people a ballpark. So that means there are probably about 1,000 under 18 just in San Diego County alone. The conditions can be pretty quiet, and people can be healthy looking until they have a dangerous heart rhythm event. Lots of those events consist of a true faint with exercise or activity. So that's an important sign for people to keep an eye out for.
Rachel, tell us a little bit about Bella's story, and then we'll chat with Bella too. There was a moment that you knew something was wrong, right?
Well, Bella was only 7 years old when she had her first faint cardiac episode. We had absolutely no idea that anything was going on. She was seemingly a healthy child. Like Dr. Perry said, this is an invisible condition, so looking like a normal, healthy child, and you could still have a rare condition like this. So fortunately, she was diagnosed very young, and I think that the biggest thing we want to share with people is to advocate for yourself, because these conditions are rare, and even though you may not see that something is going on, you really have to push for research and push for testing to figure out what's going on. Diagnosis is key. It's been life-changing for us, knowing what she has, and life-saving for her. So Dr. Perry had a big hand in that. So we're very thankful for all of his.
And Dr. Perry, you diagnosed her with a CPVT, right? Can you explain, is that part of the SADS umbrella?
Yes, it is. It's a genetic condition that affects how the heart goes off electrically. And it's got a very long name to it. That's why we just abbreviate it CPVT.
Gotcha.
But it's basically a lot of adrenaline in your system at the time triggers a dangerous heart rhythm problem.
Bella, how are you feeling here this morning? Quite the road you've had over the past 9 years, right?
Yeah, I'm great.
Tell us a little bit more about your condition and what it's been like to live with this, how you've been able to, kind of fight back.
Because I was diagnosed so young, I haven't known much different, but the most important thing is to advocate for yourself. No one else knows what's going on except me.
And I understand, Rachel, Bella's school has really helped out with this, becoming the first accredited heart-safe school in California. Can you tell us a little bit about that and your efforts involved with that?
Yes, Bella's elementary school, Old Town Academy, we worked very hard to have them become a heart-safe school, and that involved the SADS Foundation really helped us with putting together that program. The children and the staff all get trained annually for CPR and AED awareness, and just providing a safe environment for your family is the goal. So the more people that know how to do CPR and how to use an AED, the safer everyone will be.
Look, this may seem like super unique, but one of our beloved reporters, Chris Groh, his brother is going through this and has lived with this through his life. So, this does happen to a lot of people out there, Doctor. What do you want our viewers to know if they should see something, if they should be concerned? What kind of warning signs should they be on the lookout for?
Yeah, I think there are two things, as Rachel was saying. There's prevention and early diagnosis, and then there's effective rescue treatment, and that's CPR and AEDs. We are lucky in California that California is one of the maybe 20 states in the U.S. that has an AED requirement. So if people are CPR trained, and if you know where the AED is in your school or other facilities, if you know where it is and have some knowledge of how to use one, they're very, very easy to use. That would be extremely helpful.
Rachel, Bella, you guys have been helping out in that too, right? The AED, the CPR training, there's events that are going on where people can learn how to do this, right? Tell us a little bit about your involvement with that.
You want to tell them what you did this weekend?
Oh, on Saturday we did a CPR training for our neighborhood. CPR and AED.
We're also working with Rady's and Project Adam to also get her high school to be a heart-safe school, Our Lady of Peace. So just spreading awareness is key.
And Rachel, whether your kid has SADS or you're someone you know or not, these are just good things to know, right? How to work an AED, how to do CPR. I mean, you could really save a life knowing these life skills.
Absolutely. I mean, it's a very simple skill to learn. It's not easy. It's hard work doing CPR, but it's an easy skill to learn. And every minute makes a difference. So if you can simply learn those basic skills, you can make a difference in someone's life.
Bella, give us your message to everyone watching right now about SADS, living with it, how to combat it. We love seeing your smile here this morning. How can we keep those families and their smiles coming?
I don't know, just like advocate for yourself and know what's going on.
That's right. Advocation is a big part of this. Education too, right? Dr. Perry is a big key in this.
That's right. There are two takeaways, as we've mentioned. One is a website, stopsads.org. That's the SADS Foundation website. And then the other is to look up under Rady Children's for the Project Adam involvement. That's related to the AED use that we've been talking about. Super important.
Great. And Rachel, any other events you guys have coming up that we can tell people about?
Nothing currently in the books, but annually we are out there trying to advocate for heart safety, definitely.
Then
and working with Project Adam.
We will be seeing you guys around at the events then. All right, Dr. Perry, Rachel, and Bella, thanks so much for joining us here this morning. Such an important message to get out there, especially given our Heart Health Month here in February as we're wrapping up. Thanks so much for your time.
Thank you.
Thanks, Eric.
All right.